the perfect storm is going to be brewing as we have 4 or 5 problems grow. And the 4 or 5 problems, I think, are rising uninsured. We know there are about 47 million uninsured in the United States, and that's grown to over 16% of the population. And they lack access to the healthcare system and have increased uncompensated care. And a second big problem is rising healthcare costs. Healthcare costs have been rising about 10% a year for the last 40 years, and that also hits individuals directly in their rising health insurance premiums. And health insurance premiums hits them directly in their pocketbook by reducing their wages. So that's a big problem for them directly. A third problem is long-term care, which often doesn't get a lot of attention, but I think is a sleeper problem in the healthcare system. It hits mostly the the elderly, but the rest of us have to deal with that with our parents and our grandparents. And the long-term care problem is really a problem of rising costs, access, and quality of nursing homes, long-term care, home health systems, and that problem is just going to continue to grow as the population ages. A third problem is the quality of healthcare, which has gotten a lot of attention with the recent Institute of Medicine reports, which have shown that perhaps as many as 90,000 people die in hospitals from preventable mistakes through medication errors and things like that. So there's been a lot of attention on changing the quality, improving the quality of healthcare. So we've been doing a lot with that. And we need to pay attention to things like electronic medical records, improving electronic medical records, improving technology in physicians' offices and hospitals. And then the final problem, which I think is getting increased attention, is declines in the workforce. And there's been a decline in the nursing workforce. Some people just quitting because of stresses on the job and retirements, and physicians are showing some increasing retirements and stresses on the job. And with the retirement, the baby boom generation, I think some of the physicians also will be retiring as well, so creating workforce issues there as well.